Good morning and welcome to Trevor Phillips on Sunday. Tens of thousands died who didn't need to. That's the claim made this week by Dominic Cummings, who we can be pretty sure didn't get an invitation to celebrate his former boss's wedding yesterday. In 7 hours of testimony to MPs, he painted a picture of dithering and incompetence among the Johnson administration's senior ministers, civil servants and advisers. And perhaps most damningly, he says that the problems which led the government to let people down are still in place today. In the next hour, we'll ask what needs to change to do better next time, because there will be a next time. In a moment, we'll be speaking to the Vaccines Minister Nadhim Zahawi. The shadow leader of the House, Padgham Debonair, tells us what Labour would have done differently. We'll be asking one of Britain's leading public health experts, Professor Linda Bauld, what she made of Dominic Cummings' testimony earlier in the week. And is he right that so many senior officials are completely out of their depth? Lord Kerslake is a crossbench peer and former head of the civil service. We'll also take a look under the bonnet of the government with one who's been there and done that, former Downing Street head of communications, Alastair Campbell. And finally, around 1 in 3 of all COVID deaths were in care homes. We'll be speaking to the chair of the independent care group, Mike Padgham. But first, the Vaccines Minister, Nadhim Zahawi. Good morning, Minister. Did you get an invitation to the wedding yesterday?
No, but I want to congratulate the Prime Minister and Carrie Symonds on tying the knot. And it's a great feeling as you come together. And of course, I think it's a wonderful thing for both of them that they have really sort of made their marriage vows to one another.
The fact that this came out of the blue, is this a hint to all couples who are waiting and delaying their marriage, hoping that after June the 21st, they'll be able to invite more than 30 people? Was the Prime Minister's and Carrie Symonds' decision to go yesterday a hint that there's no point? June the 21st is not going to be what we hope it was going to be.
No, I wouldn't extrapolate anything from that, Trevor. On the 14th of June, we will set out very clearly the data that we are continuing to gather from step 3, which was on the 17th of May, and then we'll share that with the nation, as the Prime Minister has done in each and every step, from step 1, 2 and 3, and then, of course, step 4. We continue to vaccinate at scale. We are almost at 39 million people now with at least 1 dose, and almost 25 million people with 2 doses. So I think the important thing is to keep going vaccinating at scale, but also share the data on the 14th of June, as we have done in the past, to give people the ability then to plan ahead.
OK, we'll interrogate just how consistent the government has been with that data, not dates promise in a moment. But I just want to ask you this morning about a story that's in the Sunday Times saying that intelligence sources have suggested that it's feasible, that's their word, that the worldwide pandemic came from a Chinese lab in Wuhan. Make sense to you? And why is it taking so long to get to the point where we just know it's feasible?
Well, I think it's really important that the WHO is allowed to conduct its investigation unencumbered into the origins of this pandemic, and that we should leave no stone unturned to understand why, not only because of, obviously, the current pandemic that has swept the world, but also for future-proofing the world's capability to deal with pandemics. And it was also really good to see the Prime Minister announced the sort of global radar, which we are leading the way. We account for just under 50% of all genome sequencing of this virus, and the setting up of a global radar to be able to track virus mutations, virus variants, is going to be incredibly important. But the WHO has to be able to conduct its investigation unencumbered.
You have to depend on WHO data and guidance for a lot of the things that you do in your job. Do you feel comfortable depending on an agency that's saying now it's feasible that this came out of a lab in Wuhan, but in January was saying that a leak was extremely unlikely? Does that seem like an agency that you can trust?
Well, I think the WHO, at every step of the way, has tried to share as much data with the world as it is able to verify. This is a very difficult situation, as we've seen around the world, not just in the WHO, but of course in our own country, with our own evidence gathering and of course advice, and in other countries, every country, whether it's Singapore or Australia or New Zealand or elsewhere, we've all had to, collect evidence and then act upon it. And I think it's only right that the WHO is allowed to conduct its investigation unencumbered, to be able to, for all of us to understand and to deal with this and future pandemics.
I ask this, Minister, because at the heart of this week's discussions have been the question of whether we can trust our authorities. And I want to come to the issue of what Dominic Cummings has been saying to us this week. He took aim at the civil service, at ministers, indeed at himself. But his gravest accusation was that tens of thousands of people who didn't need to die perished because of your government's failures and because you didn't level with the people. He said, I think that the idea that any kind of serious inquiry and lessons learned doesn't start until next year is completely terrible. The families of all tens of thousands of people who died didn't need to die. There is absolutely no excuse for delaying the inquiry because a lot of the reasons for why that happened are still in place now. What he's really saying is the most damning aspect of his allegation is that the failures of the government, that we can't trust government, and that the failures and mistakes that led us to this situation are still there. How can we trust you?
Well, I would say a couple of things on this. One is that we will have a proper statutory inquiry where people will come and give evidence under oath. So we've heard parts of the story. Of course, every life lost is a grandfather, grandmother, father, uncle, aunt. I lost my uncle to this terrible virus because we couldn't get him vaccinated in time, although he was eligible for it. So I know the pain of losing loved ones to this virus. We've also saved many lives. The Public Health England's data, the last release data, suggests that almost 40,000 people have been spared going into hospital and serious illness because of the vaccination programme. Over 13,000 have not lost their life, are alive today because of the vaccination programme. So I think the right thing to do is to wait for that inquiry in spring of 2022. Let me tell you why I think it's the right thing to do, Trevor. Just one tiny thing. If you listen to Professor Jonathan Van Tam, who's working all hours, 19 hours a day, 7 days a week, and he literally was pleading with the nation to say, please not now, because we need to carry on. We remain in the middle of a very serious situation with the coronavirus pandemic, and of course the rest of the world remains in that situation as well. So it has to be the right thing to do is to have an inquiry when we can learn the lessons, and we will absolutely do that. And of course we will... Sorry, Trevor.
We hear this point, Minister. We hear this point. However, ministers come on programmes like this all the time, and I've heard Matt Hancock say this maybe a dozen times. We are learning all the time. We are learning new things as we are going along, and we know things that we didn't know last year. Now, Cummings had some choice words about ministers and their shortcomings, and he said, in particular about Matt Hancock, that he should have been fired at least 15 times for, let's put it mildly, misleading the public by claiming he had been putting a shield around care homes last year. Cummings said, We were told categorically in March that people would be tested before they went back to care homes. We only subsequently found out that had not happened. Now, all the government rhetoric was, we've put a shield around care homes and blah, 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 Cummings said. It was complete nonsense. Quite the opposite of putting a shield around them. We sent people back to care homes with COVID. Now, the point here is not whether the vaccination programme has worked, whether you've tried your best, but whether when you speak to the public, you have been clear, you have been direct, you have told us the truth and the whole truth, you have levelled with us. Cummings is saying that the one thing that you can control, which is what you say to the public, you haven't actually done straight.
Well, I don't recognise that characterisation because I've been working for the past 7 months with Matt Hancock, and I can tell you that every day he comes into the office and he focuses on using every resource available to us to be able to save lives, not least with this vaccine rollout that I've been responsible for reporting into him and into the Prime Minister. I think it's really important to remember and to put a bit of context around this, Trevor. You know, in the eye of the storm of a pandemic early last year, we only had the capability to conduct about 2,000 tests a day. You know, our diagnostics capability in the UK was almost non-existent. Today, last week, last 7 days, we conducted over 6 million tests. So to say that, hindsight is a wonderful thing, but to say that, for some reason we haven't been levelling with people, I think is wrong and is mistaken. At every stage, hindsight. Matt Hancock used every resource available to him to do the best possible job for the people that he needed to protect.
This is not hindsight. Let's deal with a question I actually asked you. Nobody's contesting whether ministers worked hard, whether you tried to do your best. The question was whether you told us the truth as you knew it. Now, last summer, a consultant geriatrician told the British Medical Journal this: before any instruction from NHS England, emergency legislation or government cash injections, acute hospitals around the country were busy implementing escalation plans to prevent hospitals from being swamped. Many of us were in good faith and for understandable reasons in that early pandemic context, sending people to care homes with or without COVID-19 testings. Look, this is a senior consultant in a big London hospital. All he's saying is that government had a difficult choice to make, and you decided the more important thing to do is to protect hospitals, even if that meant some risk to care homes. Why can't you just say you had a hard choice to make and you made a brave call? Why can't you just say that?
Well, I think what I was trying to say to you is exactly the situation that, as we found ourselves in early last year, when we entered this pandemic, we could only conduct about 2,000 tests a day. And you had to make sure that you test the front line as well as those who are being discharged into care homes. And on the 15th of April, when that decision was made and shared with the country and with the system, that people will be tested, the NHS then operationalised that, and we grew testing capacity, and that target of 100,000, I think, was equally important, because actually setting targets in government is a good thing, as I have discovered. And then we continued to expand it, Trevor. So I don't think...
Minister, but you must have known that there was some risk. Why can't you just say, we knew that, but we had a big decision to make, and we decided making sure that the NHS was not overwhelmed was the priority?
But both were the priorities, Trevor. That's the whole thing. What I'm trying to explain to you is both things were the priority, but hindsight is a wonderful thing. You work with the resources you have. You do your best with whatever resource you have available to you at the time, as well as then investing in growing it. So if you start a pandemic with the ability to only conduct 2,000 tests a day, you quite rightly say to yourself, how am I going to get to a place where I can do over 6 million tests in 7 days, which is what we've just delivered this past 7 days. That is the whole point, is you grow. We've begun this pandemic only able to manufacture 2% of our PPE. We now manufacture about 70% of our PPE. Diagnostics was similar, 2,000, and now, as I say, the capability to do probably over 1 million a day of tests. So I don't see these things as being a trade-off. You have to do both things, but you do them with the resources that are available to you at the time.
It really wasn't what anybody said at the time, and it sounds a little bit like Boris Johnson cakeism, that you want it both ways. But let's just deal with some of your own responsibilities right now, Minister. You personally have overseen the great success of this administration. 50 million vaccination doses, third of the population. You've talked about it earlier in this conversation. We've got a lot of stocks, we've got the machinery. Why aren't you keeping up the pace and giving jabs to children as recommended by the European Medical Agency?
Well, because first of all, our own regulator has not yet approved giving vaccines to children. You have to make sure the vaccines are incredibly safe before you give them to children. We've seen the Pfizer-BioNTech vaccine being approved by the US regulator and the Canadian regulator for 12 to 15-year-olds. The MHRA, our own independent regulator, and of course the Joint Committee on Vaccination and Immunisation will have to look very carefully at this, because of course you're not vaccinating children. Some obviously get infected and get long COVID, but on the whole, you're vaccinated to protect their families and their communities and the country. So vaccines, as Chris Whitty has said, have to be incredibly safe before you administer them to children. But we will be ready. The infrastructure we've built allows us the ability to deploy vaccines for 12 to 15-year-olds, as well as, of course, planning for the boost in the autumn and the flu vaccination campaign. So the infrastructure is there, but of course the clinicians have to make that final decision.
There are reports today that you want to make potentially vaccination compulsory for NHS staff to make sure that you crack down on the spread of the virus in hospitals. For some people, that makes sense. Is that what's going to happen?
So we've recently consulted on the social care frontline staff in terms of duty of care to those who are most vulnerable. You and I have been just talking about the residents of care homes who were, by the way, put at the top of the list of the vaccination programme, and that duty of care we've been consulting on in terms of condition of deployment into social care. I think it's only right that we look at the healthcare system as well. You and I have been talking about infections out of hospital. It's absolutely the right thing. It would be incumbent on any responsible government to have the debate, to do the thinking as to how we go about protecting the most vulnerable by making sure that those who look after them are vaccinated. There is precedent for this. Obviously, surgeons get vaccinated for hepatitis B, so it's something that we are absolutely thinking about.
It's possible. Let me just ask you one last question, Minister. Thank you for your time. You've had to depend on what people call the Whitehall machine, the civil service, Public Health England, and so on. One of the issues that emerged out of Cummings' testimony is his pretty dusty opinion of the level of delivery and the capability of the civil service in a crisis. What do you say to Cummings and indeed other people who've been saying this week that with the best will in the world, a lot of clever people in our civil service, it literally is not up to snuff, not modern enough, not capable, and that actually we need to take some urgent action to get that machine into the 21st century?
I would respectfully disagree, and I tell you for why. And I've been doing this job now for 7 months, and I wished that Dominic Cummings was there, because he wasn't involved in the vaccination programme, but I wished he was there because he would see the capability of the civil service, whether it be Maddie McTurnan, who's my senior responsible officer on vaccine supply, Ruth Todd, who works with her, Steve Glass, or Emily Lawson, the brilliant senior responsible officer at the NHS doing the deployment. He would have seen the civil service at its best, coming together with our armed forces with, of course, the NHS family, doctors, nurses, the GPs, the pharmacists, all coming together with the private sector, of course, and local government. Local government's been an incredibly integral part of this. He would have seen a machinery of government coming together with extraordinary talent in the civil service, delivering this programme. And if he'd been there, I think he would have maybe possibly had a different point of view in front of the committee.
You said over the last 7 months the civil service at its best delivers, but the problem is it's probably not always at its best. Let me quote you what Mr Cummings had to say on all of this. We all should be asking, and you guys in the political parties need to ask yourselves, what is it about your parties that give choices like Johnson and Corbyn? And we have to ask, what is it about Whitehall that promotes so many people who are completely out of their depth? Do you have no sympathy with that view?
Well, all I can say to you, and we all fall back on the experiences that we have, the experience of being the Vaccines Deployment Minister, I don't recognise that point of view. There are extraordinarily talented people in the civil service doing an incredible job, and I can tell you, because I came out of the private sector into politics, as you know, Trevor, you and I go back a long way, I would hire all of them in a heartbeat. They are amazing people doing amazing work, working all hours and delivering operationally competent people. And as I say, if Dominic Cummings had been involved in the vaccination programme, I suspect he may have changed his mind on that view that he gave the committee.
Minister, thank you very much for your time this morning.
Thank you.
Now, as many as 3/4 of all new coronavirus infections across the UK involve the so-called Indian variant. And the Health Secretary, Matt Hancock, says that the number of new cases is rising again throughout the country. That rising rate of infection is casting doubt on whether the government really can lift remaining restrictions on June the 21st. Public health expert Professor Linda Bauld joins us from Edinburgh. Professor Bauld, you heard what the Minister has to say. Does that sound like we are heading to end of lockdown on June 21st to you?
I think it's very ambitious, Trevor, looking at the national picture. The average 7-day average for cases at the moment is well over 3,000. If you look back just to the first week of May, we were around 2,000. And in some parts of the country, including parts here in Scotland, we've seen a big increase. And I know that's not translating yet to large numbers of people in hospital, but there are more people in hospital, particularly those in midlife who may only have had one dose of the vaccine. So looking ahead, the 21st of June is very soon. And I think to avoid more preventable deaths that you've just been discussing with the Minister, we really need to be cautious at the current time.
So you actually, I know that you're not in the policy territory, but if you had your way, you would actually have to be positively convinced that opening on June the 21st is safe before you followed the roadmap as it currently is, which is to lift all restrictions after that date.
That's correct. And I think even from policy colleagues, including in the devolved nations, we've been hearing very cautionary messages, and that we can't commit towards the end of June, the sort of summer solstice date. I really think that it's too early to be charging ahead. I would like to see several more weeks' data, and the kind of evidence I want to see, and all my colleagues, is that these chains of transmission, these links between the fact that we always knew we'd have slightly more cases when we opened up, but it's moving through the system to then people becoming unwell. We don't want anyone to become severely unwell with this virus, and we really have got just over 4 in 10 of the population who've got good protection from both doses. Other countries, final point on this, that have opened up fully, like Israel, have many more in their population that have got full protection from the vaccines, and we're just not there yet.
But Professor Bauld, you're a distinguished expert in behavioural science, amongst other things. Changing the signals, which at the moment say we're heading towards opening, do you think, we're not Israel, do you think that Britain would respond well to that? Or are we now at risk of creating a situation where a population has been relatively compliant, seeing its summer holidays slipping away underneath lockdown, might start to revolt?
Well, there's 2 points there. The first one is, yes, the public are totally fed up. Everybody just wants things to go back to normal, or most things to go back to normal. I think we recognise that, and there is frustration. But the government said, particularly the UK government, said data, not dates. And so I think they really do need to follow the data. And as I say, at the moment, the situation is not entirely moving in the right direction. On compliance, we heard from Dominic Cummings criticism of behavioural scientists, including on SPI-B at the beginning of the pandemic, saying there would be behavioural fatigue. That didn't come from my colleagues on SPI-B. And actually, the British public, the levels of adherence and compliance have been truly astonishing. And when you look at the latest data, some of the surveys that have been done, there's a significant portion of the population who are still very, very concerned, recognise that we shouldn't be rushing ahead. And so I don't think we're going to see rioting on the streets, despite the fact that we have had demonstrations around vaccines, etc. That's a small proportion. What most people in this country want is not more people to die, to be able to move ahead with more confidence, and to know that we're not going to have to take backward steps and go back into local or national restrictions. Nobody wants that.
So forgive me, I missed a second of what you were saying, but am I to understand that you actually think that what Mr. Cummings now says, he said at the time, which was harder, faster, lockdown quicker, was correct?
I think so. I mean, I do have sympathy for some of the decisions taken very early on in the pandemic, when we didn't know about airborne transmission, we didn't know so much about asymptomatic transmission, etc. And a number of countries in Europe didn't act quickly enough. I think, Cummings' evidence, I mean, it was really shocking listening to that, and it will all be poured over. And I don't think we should, be necessarily making judgments now about what he said that was correct and wasn't correct. But I think a lot of things he said about decisions that were taken that could have prevented such a big second wave, things we should have learned around travel, around ventilation, around moving cautiously, protecting particular groups. We're still not necessarily being that cautious and using that evidence. So I think some of what he said, we really do need to learn from, not in a future public inquiry next year, but learn from now.
Well, of course, that's important now. At the heart of much of what we're doing now is the relationship between politics and science. And I just want to ask you, because I'm interested in this as a scientist, the government's been saying from the start of this that it has been and will be guided by the science. Listening to Dominic Cummings and watching from your own experience and your own participation, do you think that's actually what's happened?
Not entirely, no. I mean, first of all, there's no single science. Scientists always disagree, and then the consensus needs to be reached. But it's very clear, we were delayed in getting the SAGE papers, so we can now all pore over them. And it's clear at several points in the pandemic, the government didn't follow the advice of SAGE, including the behavioural science advice. That's very clear. But in looking back to the autumn recommendations around taking early action in September, those were not taken. So I don't think the government has always followed the science. I think it's completely incorrect to say that's the case. In some aspects they have, in some aspects they haven't. And the final point I would make there is that one of the things, Trevor, to me that's most regrettable about the last 14 months is that governments have often blamed the public for things that have gone wrong, the public's behaviour. And just going back to the data I was referring to, the public have suffered, they've tried their absolute best, and I think, government needs to take responsibility for what's occurred.
Professor Bauld, thank you so much. I no doubt we'll return to this many, many times. Now, the Labour leader, Keir Starmer, has this morning warned that plans to lift nearly all lockdown restrictions on June 21st are at risk because of what he calls serial incompetence inside Boris Johnson's government. Would Labour do any better? I'm joined now by the shadow leader of the House of Commons, Padgham Debonair. Ms Debonair, you listened to the Minister for Vaccines. Do you believe that the government was straight with us?
Well, I think what we've seen, unfortunately, is all throughout this crisis is a government that's been too slow to take decisions at crucial points. Everybody understood last March that it was an unexpected pandemic, that there were difficult decisions to have. Was too slow to heed the advice of their own experts. The leader of the opposition, we needed a circuit breaker in the autumn. That advice was not taken. The advice again about Christmas was not taken. Those were difficult decisions, but that's the nature of leadership. And the Prime Minister failed to show leadership when it mattered. And I'm afraid to say thousands of people have suffered because of that.
OK, forgive me, there was a small dropout in your signal there, but I think we'll keep going on this. Let me start with the question I put to Vaccines Minister. Do you think that the compulsory vaccination of NHS staff might be a wise move, and would Labour support that, even though it might mean that people essentially have to choose whether they stay in their jobs or they maintain a principled opposition to vaccination?
Well, given that we've got a recruitment crisis in parts of the NHS, I think it's far more important that we try and work with staff rather than against them. Threatening staff, I don't think is a good idea. I think it's where we've done well in the vaccination programme is where Public Health England and NHS have been able to work with people on their doubts and questions and give them accurate information. That's seen the rates of vaccination go up. I would like to see the government work with the NHS and social care staff.
Well, that's fine to say let's work with staff, but there are some staff who basically say, I'm not having it because I do not believe in it and I won't take this vaccination. It's not possible to work with somebody who has a very sincere belief that they shouldn't take this thing. So let me ask you again, where will you stand if we get to that point?
Well, when I say work with, I mean try and find out why people have got reluctances, help them to get accurate information all along the way of this vaccination programme, which is a fantastic vaccine programme, and all thanks to the scientists and NHS staff who've been responsible for it. More and more people who were initially reluctant have gradually decided to take the vaccine because they can see it's the right thing to do. Now, I think that that's a better way of working with people than threatening them, and I think it's important that we listen to what people's fears are, but also think about how we might organise so that people can get that accurate information and choose to take the vaccine in a timely manner, because it is the best thing we can do to protect ourselves and each other.
Your leader this morning's writing in the newspapers about how Labour would do things better. Let's just talk about a couple of aspects of that. First of all, the government machine. Everybody agrees that the government did one thing right, which is a vaccination programme. But actually, in order to get that right, they brought in an outsider and a team from outside, the Vaccine Task Force, which didn't operate according to the conventional Whitehall rules. Now, at the time, Labour said this was awful. Tories, cronies, you criticised Kate Bingham because she led that task force for spending too much money on public relations and so on. Do you want to apologise to her now? Oh, well, it seems that question will not be answered by Padgham Debonair because she has dropped off the signal. OK, well, we might come back, but in a moment, what we're going to try and do is look under the bonnet of the government with the former head of the civil service to see what kind of shape the machine's in. But first, let's remind ourselves what Dominic Cummings actually had to say on Wednesday.
The truth is that senior ministers, senior officials, senior advisers like me fell disastrously short of the standards that the public has a right to expect of its government in a crisis like this. When the public needed us most, the government failed. Tens of thousands of people died who didn't need to die. The government rhetoric was, we put a shield around care homes and blah, blah, blah. It was complete nonsense. Quite the opposite of putting a shield around them. We sent people with COVID back to the care homes. The Secretary of State for Health should have been fired for at least 15, 20 things, including lying to everybody in multiple occasions, in meeting after meeting in the Cabinet room and publicly. The view of various officials inside Number 10 was, if we have the Prime Minister chairing COBRA meetings and he just tells everyone it's swine flu, don't worry about it, I'm going to get Chris Whitty to inject me live on TV with coronavirus so everyone realises it's nothing to be frightened of, that would not help actually serious planning. You guys in the political parties need to ask yourselves, what is it about your parties that give choices like Johnson versus Corbyn? And we have to ask, what is it about Whitehall that promotes so many senior people who are completely out of their depth? There is no plan. We're in huge trouble. I've come through here to the, Helen McNamara said, I've come through here to the Prime Minister's office to tell you all, quote, I think we are absolutely
Lord Kerslake, Bob Kerslake, was head of the civil service for 3 years to 2014, having spent more than a decade as chief executive of Sheffield City Council. In recent years, though he himself sits as a crossbench peer, he's advised the Labour Party on what it needs to do to prepare for government. Bob Kerslake, what is it about Whitehall? Did you get any answers from Dominic Cummings' testimony? Did you learn anything that you didn't already know?
Well, look, I've been a vocal critic of Dominic Cummings and some of the things he said, but I have to say we learnt a lot on Wednesday, and we should, in a sense, be grateful that we've had this early indication of just how things actually worked behind the number 10 door. And there were, I'm afraid, some serious failings that have to be recognised. The focus has been on the political failings, but there are also lessons to be learned for the civil service and indeed for the whole of the government machine as well. I'm a great supporter of much of what the civil service does. There are some very able people there. But if we don't learn, then there's a real risk, and this was a point that Cummings made, that we're simply ill-prepared for the next time we face this kind of crisis. So yes, there are some serious lessons to be learned here about our preparations, about how we listened and learned the experiences from other countries, about the pace at which we did things, and crucially about the openness with which we communicated with the public. So yes, definitely, there's something to learn here.
Thank you. This is very interesting. These issues of pace and openness were, in a sense, illuminated by an example that he and other people have quoted, which is that the great success of the government during the pandemic, whatever its other mistakes, has been the vaccine programme. And that was delivered by a task force recruited largely from outside Whitehall, operating to rules that are not unknown, but quite uncommon within Whitehall. Is that the way you saw it? And do you think that we don't have to go abroad? Can we learn lessons from that experience?
I think we can. It's fine to bring in outside people at the right point, at the right time. But of course, they work with the civil service and crucially, in this instance, work with the NHS. We talk about the success of the task force, but what about the success of our NHS in organising and delivering those vaccines? A great success, and we should celebrate that. I'm not averse to bringing in people from outside. But what I think is our fundamental challenge as a country here, Trevor, is our complacency and arrogance, the so-called British exceptionalism that we're always going to be the best. And we just need to approach the lessons learned here with a sense of humility. We have something to learn and something to improve. And by the way, I think we should be having this inquiry sooner rather than later. I do not accept the arguments that we heard from the minister about the delay. It's vitally important for the families who lost loved ones or who got long COVID to hear those lessons now. Otherwise, all we're going to get is the kind of partial tit-for-tat testimonies of Cummings and others.
So you're pretty clear, really, here, aren't you, that all of those people who pop up on radio and television and say we have this extraordinary Rolls-Royce machine, that actually the problem is all to do with the politicians and their silliness and so on, really need to take a good look at the way our public services work. Bingham made a rather interesting example where she said that they had to call a meeting and they were told that they had to invite 285 people within the civil service to it. Is that the kind of thing that you think we need to do something about?
Yeah, we need to be more agile. No, don't get me wrong, there's a lot of things that the civil service does extraordinarily well. So this is not an attack on the civil service. My argument against Cummings was that you don't change and improve organisations by going to war with them. But if we want to really be the best, we have to learn lessons. We need to be more agile. We crucially need to be more prepared. In 2019, we thought we were one of the best prepared countries in the world for a pandemic. We clearly weren't. Similarly, the communications has been a major issue. We weren't even allowed to know who was on the SAGE committee, never mind what it was actually saying and doing. I think there's nothing short of a revolution needed in the way we run this country. It's about how politicians conduct themselves, but it's also about how our public servants do their role as well.
Not that often the head of civil service calls for a revolution, but I guess what you're saying is that if we were hit with something similar to January 2020 in January 2022, in the present configuration, actually, we'd be no better off in coping with it.
Well, we'll have learned some lessons, of course. I don't want to say there won't be, and indeed there were lessons learned. But just look at the way in which we handled the second lockdown. It felt like we really had learned almost nothing. And this is the point Keir Starmer has made, that you can just about understand how things were in the first lockdown. But to go through it again in the second lockdown shows a paucity of learning, really. So we wouldn't be as better placed as we need to be if we faced another pandemic. And crucially for me, we need to be better at two things. Number one, we need to be better at long-term planning in this country, not always reacting, if you'll forgive me, to the latest news story. And number two, we need to be much, much better at working across government in a collaborative way and being able to move rapidly. You don't need 250 people in a meeting if you're going to make serious decisions. Kate Bingham was right.
One quick point, if I may. You, in a speech when you left in 2014, talked about the need for greater diversity of skills and a new approach to data and devolution. Patricia Hodgson, who you know is a distinguished public servant, published a report this week which actually said that the civil service really needs to up its game in the use of technology and digital and so on. Do you detect that there's been any response to your 2014 speech in the 7 years since in improving the way we deal with delivery in the civil service?
I think we've got a lot more to do. I believe passionately in open government. I believe passionately in having a more diverse civil service, not just in terms of ethnicity and gender, those are crucially important, but actually in terms of class as well, in terms of the range of skills and how much we value those technical skills. That hasn't in the past been seen as the most important thing to have in being a civil servant. We now need to really recognise that those deficiencies I talked about have to be addressed if we're going to be genuinely world-class. We should, in a way, stop saying we're world-class until we've addressed them.
Lord Kerslake, thank you very much indeed.
Thank you.
Now, friction between unconventional special advisers and senior civil servants is not a new thing. Let's talk to one of the most talked-about cuckoos in Whitehall's nest, Tony Blair's former Director of Communications, Alastair Campbell. Now, Alastair Campbell, listening to Dominic Cummings, I could hear the voice of a highly intelligent, charismatic individual sitting at the heart of government who'd arrived in number 10 at the right hand of the Prime Minister with a mission, only to find himself in the glare of the media, unable to, utterly frustrated by the shortcomings of Whitehall and the mendacity of some of his own political colleagues. Does that feel in any way like a familiar story to you?
Well, only up to the point where you got to the end there, because I think when we're talking about mendacity, Dominic Cummings is right up there with Boris Johnson, not least in the Brexit campaign. And I guess the equivalent, I would only compare myself if I felt that after my time in Downing Street, I came out and trashed everything that Tony Blair and Gordon Brown stood for and did. And I will never do that because I think they were committed public servants who did a lot of good for the country. And I think what Dominic Cummings' testimony, even accepting, as Bob Kerslake says, he's a pretty unreliable witness. However, what he said is borne out by what lots of us have been saying for some time, that this whole pandemic has been scarred, the government handling has been scarred by the character of the Prime Minister, by his inability to govern in a rational, clear, sensible way, to appreciate systems, to work with those systems. And I thought it's interesting, Bob said the point about we've got to be more long-term, worry less about the day-to-day media. I thought one of the most telling parts of Dominic Cummings' testimony was when he said, and it's something I've thought, that Boris Johnson is basically a journalist. And Cummings said he wakes up every morning, has a flick through the papers, thinks, what should we do to sort of, stay in the story today? And he actually did that thing about rubbing his fingers, feeling the wind. And that is not government. That is not leadership. And I think what Cummings has exposed is that if the country elects somebody like Johnson as Prime Minister, then the country is going to pay a very heavy price for that. We've paid it in this pandemic.
Let's leave aside the question of whether all journalists behave in that way, Alastair. I think I know some who actually read the newspapers and so on. But I get your point about Johnson and so on, but the truth is, it doesn't feel like the country really agrees with you. Even after Cummings's testimony this week, opinion polls have Conservatives between 10 and 18 points ahead. And indeed, in some polls, they've increased their lead post-Cummings.
Well, listen, I honestly don't care about the polls. I care about what I think about the country and where the country is heading with this Prime Minister and this Cabinet. And you were talking there to some of the principles of government with Lord Kerslake. Well, let me just go through the principles that are meant to govern standards in public life. The Nolan principles: honesty, openness, which Bob talked about, objectivity, selflessness, integrity, accountability, and leadership by example. I think Johnson only scores on the last one in that he leads by the example that tells his cabinet ministers they can be as useless as Gavin Williamson, they can break the ministerial code as often as Priti Patel, they can lie in the way that Cummings says that Hancock has, and none of them will get held to account for that, because Johnson doesn't want to get them held to account, because he's the worst of the lot when it comes to dishonesty in public life. So the polls, I think, are a reflection of all sorts of things. They're a reflection about the state of the opposition. They're a reflection of the success of the vaccination programme and people feeling maybe we're just coming out of this hell. They're also a reflection of the fact that I think the media does not hold this government to account, nor does Parliament, frankly, does not hold this government to account in the way that they should. I think the media has become incredibly supine in its coverage of the government, and even on the Cummings stuff. Yes, wall-to-wall coverage, but then by the weekend it's, oh, well, who cares what Dominic Cummings thinks, the sun's shining, vaccination programme's going well, Johnson's got married, let's just move on. And I think the country's just got to decide, do we care about the fact that we have a government and a Prime Minister that, as Cummings, and I agreed with him this, they are directly responsible for tens of thousands of deaths. Do we care about that or not? Do we care that a Prime Minister stands up in Parliament? You've now got that video from Peter Stefanovic, over 20 million views, hardly anybody in the mainstream media covering it, where they set out, we talk about has he broken the ministerial code. He breaks the ministerial code virtually every time he stands up in Parliament. They're meant to tell the truth. And this is what populism has done to our politics.
We could talk about your views about this government forever, and you've been pretty clear. Let's put it that way on that. But let's just talk about some of the underlying substantive questions here. Some of the ones that I was talking to Bob Kerslake about the nature of government, because you've been inside it. One new Labour minister complained, I think while you were still there, that he thought that when you got into government, there was this great machine, and if you're a minister, you pull a lever and the machine whirs into life and stuff happens and changes take place. And what he discovered within months was that you pull a lever and it wasn't connected to anything and nothing happens. Is that sound about right to you?
No, it doesn't. And also I think that's a bit naive, because if you think about how we got into power in 1997 was partly recognising a lot of the weaknesses in the system that, if you like, we were up against. And I think that, to be fair to the civil service at the time, yes, there were some who were obstructive. Yes, there were some who were difficult. Yes, there were some who weren't, very good at the job. But a lot of them were. And I think what sorry to keep going back to the current government compared to a kind of what I would call a rational government and a sensible professional government, what happened was that when there was clear direction from ministers, I think actually the civil service was broadly responsive. And I think one of the problems in the pandemic has been the relentlessness of the kind of mixed messaging. People not really knowing what they're meant to be saying, what they're meant to be doing. Johnson just making it up on the hoof. Whereas actually, listen, there were lots of situations, and Tony Blair famously made that speech about the scars on his back, about the difficulties of getting public service reform. However, we did deliver a lot of public service reform, not least with the help of the best of the best in the civil service. But where I agree with Bob Kerslake, by the way, I do think we've got to move away from all this language. We talk about the Rolls-Royce civil service. We have the best armed forces in the world. We have some of the best, but I think that this British exceptionalism is really not a sensible way to kind of approach issues like the ones you're talking about.
Let me take you back to those new Labour years, Alastair Campbell. You say they did a terrific job in some respects and so on. They weren't always that complimentary about you. I mean, I heard a former Cabinet Secretary on the radio this week saying that some of the rot set in with the sofa government of the Blair regime, and you were one of the people on the sofa. Some of the people in Whitehall would say this is all your fault.
Well, I don't know who that was, and I think that the whole thing about sofa government was just a complete nonsense. Tony Blair ran a very tight ship, and he embraced the civil service. I remember one of the first things he did was took me and Jonathan Powell into a room. Jonathan, who was the other special advisor who we were given these special dispensation to instruct civil servants, and he was very, very clear. We work with these people, we don't work against them. And I think you'd find very, very few people who worked with me or with Jonathan Powell or any of the others who were in there. One of the things I'm most proud of, actually, is that nobody who's ever worked for me in the civil service has ever come out and criticised the way that we dealt with them and the way that we worked with them. And, I think the other point Bob made...
Very quickly.
Go on.
Can I just ask you one other question? Sorry, Alastair Campbell.
Of course.
Which is about the effect of the last year. There have been stories this week about effect on people's mental health. And I know this is something that you are particularly concerned about. Have you got any thoughts about what we ought to be doing going forward?
Well, I am really worried about this because I understand that the government has, its main focus has been in dealing with the pandemic. But, the Royal College of Psychiatrists has warned about mental illness being the second pandemic. And, that whether that overstates it or not, I think we all know that there are going to be long-term consequences from this on mental health for students who couldn't study, for children who couldn't go to school, for business people who've lost their business, for people who've lost their jobs, for people who've lost their loved ones and not been able to say farewell. All of these things have psychological impact. And I do sense that with this government, from Matt Hancock and Johnson, and they just want, this is populism, they want to say that everything's fine. Well, actually, things are not going to be fine for some time to come. And the only way we're going to address that and get a strategy for that is actually if they recognise it. And the governments that are doing best in relation to the health consequences, the mental health consequences of the pandemic, are those like New Zealand, like Germany, like Taiwan, where they've actually said from the word go, there are going to be mental health consequences from this. And I wish that our government would take the same approach.
Alastair Campbell, thank you very much indeed.
Thanks.
Many of the people who suffered most during the pandemic were frail, elderly and vulnerable. Around 1 in 3 deaths from COVID took place in care homes. And we now know that during the first wave of the pandemic, patients taken from hospital and moved into care homes without being tested. Mike Padgham is chair of the Independent Care Group. Mike Padgham, can I take you back a year and a bit? Talk to us about running a care home in those first weeks of the pandemic, trying to keep your residents safe, but also having to cope with arrivals from hospitals without any real way of knowing that they weren't bringing the virus into your care home.
Good morning, Trevor. Can I just extend my condolences to all those people who've lost loved ones in care homes or elsewhere in the country, for that matter, because it's been a tragedy. Yes, at the start a year ago, it was very, very difficult. We were told by the department late February, actually, carry on as normal. There's no reason why we think it's going to affect you. But we could see what was happening in Europe, and we, as a provider, actually locked down much earlier, actually on the 11th of March, because we could see what was coming. But reassuring staff and relatives and visitors was very, very difficult, because at that time, no one knew what was actually going to be happening. It was frightening.
I want to show you, I don't know if you'll be able to see it, there's a graph of the excess deaths over the last year to February in care, or people who had been in care, of people who'd been in care homes. And last April, the peak climbed to 6,000. I mean, normally it's, you know, down around a quarter or a third or a fifth of that. Tell me what you felt during that spike. I mean, it must have been mayhem.
Well, it was. I mean, we had someone who was transferred to us from hospital actually on the 19th of March. At that time, we thought testing was happening. In fact, we found it wasn't, and we actually had to go and get the test ourselves from the hospital to test that person to make sure that they weren't positive. By the time we got the test, we subsequently found they were positive, and they were readmitted back and unfortunately passed away. Yes, it was dreadful. We were worried because we saw the NHS was dealing with a very difficult issue. They had PPE, we didn't. And it was reassuring our staff and our residents that we knew what was happening and doing the best we possibly could. But it was frightening. And if it weren't for the hard work of social care staff, and in fact the local authorities in our area, those figures I'm confident would have been much, much worse.
Mr. Cummings said this week that when Matt Hancock said he'd put a shield around care homes, he was telling untruths. Somebody is not telling the truth here. Hancock says he wasn't lying. Who do you think was telling the truth?
Well, I can only give it as I see it, and I don't want to accuse. I weren't there to hear who said what to whom. All I would say is I don't believe myself there was a ring of protection thrown around us in those very early days. It was difficult. We were forgotten. We've been forgotten over decades. That's the only issue in social care. We weren't prepared. We weren't ready. We didn't have the PPE. We didn't have the testing. And it took the government many, many weeks to actually see what was happening in homes. Despite our best efforts and protestations, that is why providers, I think, without their efforts, the figures, as I said just now, would have been much worse. So they take some credit, particularly the staff, of course.
Of course, there was a crisis in social care before COVID, and there is a crisis in social care now. And unless we do something about it, there will probably be a crisis in social care in the future. What do we need to do now?
Well, it's so frustrating. You're right. And I've lost faith in all politicians, really, because going through Labour, the Coalition now, and Conservatives, everyone's promised something and it's never happened. I'm at a loss to know what we can do in the future. All I would say, if something positive came out of this pandemic, it's got to be the reform of social care. And rather than people stepping down now and resigning, I want the government to actually give us a date when they're going to deliver social care, not move from it. If they don't deliver this time, then they need to step aside and let someone else do it, because we've run out of patience. It needs action today.
Mike Padgham, thank you very much indeed. That's it for the main show. Don't go anywhere, though. In just a moment, we'll be reviewing everything we heard in Trevor Phillips' The Take. Stay where you are. I'll be back after this short break.